frontliners, frontlines who have made the care of others their calling in life. Thank you, and Sidus Maasi. We all know that we all know that impacts of COVID-19 can be devastating on a global scale. But through action and collaboration, we Guam has a small window of opportunity to counter the worst impacts of this virus. Doing this means that even stronger measures need to be taken. Effective Tuesday, March 31st, 2020 at midnight, all incoming passengers, regardless of place of origin or transit, are subject to a 14-day quarantine at a government designated facility. The quarantine will be applied unless the passenger possesses a healthcare recognized and certified document that attests he or she is not infected with COVID-19 within the last 72 hours. This also means that we have to better educate people about the mandates already in place. 2 days ago, Public Health issued detailed guidance for essential business who continue to operate. Under this new guidance, businesses must enforce social distancing, requiring patrons to maintain a distance of 6 feet. They must control foot traffic, make hand hygiene easier, and frequently disinfect and clean. I cannot stress this enough, and I will continue to stress this until our fight is over. Stay home and practice social distancing. You may be tired of hearing this, but it needs to be said, understood, and practiced by everyone. You may feel fine and may even stay fine, but for those who will become seriously ill because of this virus, your absence means less transmission, less chance of infection, and will flatten the curve. Social distancing will slow down and stretch out the rate of infection so that our hospitals can cope and won't be overwhelmed. Yet, no matter how often this message is repeated, I know that staying home can seem unrealistic when you're worried about bills or putting food on the table. I want you to know that we are going to help people whose lives have shut down, people who have been temporarily laid off or fired from their jobs due to coronavirus crisis, people who don't know how they'll pay their rent or mortgage. Yesterday, I signed an agreement with the U.S. Department of Labor as the first step toward initiating a full-scale pandemic unemployment assistance program, a program that currently does not exist locally. Though this program was signed into federal law just 48 hours ago, our team was ready with the required memorandum of agreement. Now, Guam and every other impacted jurisdiction waits for program guidance that can only come from the U.S. Department of Labor. Once the guidance needed to operate this program is provided, we will act. I know that many of you have also been worried about the USS Roosevelt. COVID-19 represents a clear and present danger to the health and safety of the people of Guam. But this threat cannot be overcome by Guam alone. This is the message I consistently communicate to the Department of Defense leadership on island, and it is the message I convey to you now. Because we share many of the same concerns, I speak with Joint Region Marianas on a near daily basis. Our enemy is invisible and relentless. The virus does not discriminate, and it cannot be stopped by borders or a fence. We are all at risk. Defeating it demands that we are truly one Guam in words and action. For this reason, many of the added safeguards requested by community organizations are already in play. The Roosevelt's crew is quarantined to appear. The military is using its own test kits and working on getting us more of our own. Mission essential personnel can travel to work, but their movements are confined, subject to the enforcement of NCIS and others. More than ever before, we need unity, hope, compassion, and the political will to see this crisis through. Our COVID heroes are just a few examples of that. Today, I would like to acknowledge United Airlines. United Airlines donated more than 100 advanced emergency kit specialist supplies to GMH. This includes blood pressure cups, stethoscopes, and artificial manual unit breathing bags. Thank you to United and other businesses who are helping our healthcare workers. I'd like to ask Linda now to come up with update on the status of our virus.
Thank you, Governor. Yesterday, we conducted 23 tests. 1 tested positive, 22 tested negative. So the testing from March 12, 2020 to March 29, 2020 are the grand total of 390. And of the 390 tests, 334 are negative and 56 are positive. And of the 56, I just want to reiterate that 54 are local cases and 2 are from the naval hospital, and they are residents of Guam. In regards to the demographic, we have 20 coming from the northern region of the island, 24 from central region, 10 from southern, and 2 are homeless, thus giving 56 a grand total of our COVID positive patients. In regards to the age breakdown, to this date, there are no children all the way through adolescents up to the age of 19 that have no confirmed cases. In regards to ages ranging from 20 to 29 years of age for our positive for COVID, the age group of 30 to 39, 5 individuals, 40 to 49 years of age, 10, 50 to 59, 11, 60 to 69, 16, 70 to 79, 6, 80 to 89 years of age, 3, and those age 90 and above, we have 1 case. In regards to the gender, majority are female, 30, and male, 26. As far as the medical status, right now 31 are in stable condition, 19 are hospitalized, and of those hospitalized, we have 11 at the inpatient at GMH, 2 are in the ICU unit, and we have 6 at the SNU. 7 have fully recovered, 1 has died, thus 56 grand total of our COVID cases. In regards to the home isolation, we currently have 31 there, and of course, as I mentioned, SNU 6, and then GMHA, a grand total of that is 11, and then the self-recovered 7, I mentioned all that already. In regards to the travel history, 56 altogether. 1 came from Japan, 7 from the Philippines, South Korea 0, US mainland 3, and 45 no travel history.
And I will take questions. First today is the Marianas Business Journal. Rianne.
Hello.
Hi.
Hi. I'm just wondering if DPHSS is coordinating with the CNMI government because of the 2 confirmed cases over there.
Yes, the Department of Public Health and Social Services is coordinating and in close communication with Esther Muña. She's, I think, the head there for their Department of Public Health and Social Services. I am also working very closely with the governor. We have spoken on several occasions, and so we are aware and we are very much informed about the situation at the CNMI.
Rianne, your follow-up question?
My follow-up question would be, do you know when the Department of Labor would have those like weekly unemployment figures?
The weekly unemployment figures right now, since we had signed the memorandum of agreement with the U.S. Department of Labor, we've sort of initiated now the process of what we are going to do to provide the weekly checks. You mean the checks, right? You don't mean weekly figures, you mean the checks? Rayanne.
I mean, yeah, just to know the process to see like how those funds would be like dispersed, really.
So they are working those details out. And as soon as we get those details, we want to make sure we clarify them and finalize it before we actually go out. But we are, of course, getting prepared at the Department of Labor to provide those weekly checks to our island people. Yeah.
Thank you, Rianne.
Yep.
Next is Kevin Kerrigan from the Pacific News Center.
Good afternoon, Governor. Can you hear me?
Yes, Kevin. Thank you. Good afternoon.
I wanted to follow up on the unemployment benefit question. We're getting a lot of calls from people interested in that. And I'm wondering if you can tell us how much are the weekly benefits for each unemployed individual? How long will these benefits be paid out? How many weeks? When will it start? And how can people apply?
Okay, so there's no real, there is no definite number yet onto how much that they are going to be getting. They're looking at the average nation's unemployment insurance benefits, and then there's a clarification of whether additional insurance benefits would also apply to Guam. Once we establish those numbers and their programs, I understand by law that it is a weekly benefit for 9 months. No? Okay, so the Department of Labor Director Dave De La Sola is here, and he can give you more accurate information. He says it's not 9 months, but go ahead, Dave.
Thank you, Governor. The program under the Pandemic Unemployment Assistance lasts for 39 months. And I'm sorry, 39 weeks. And it's effective January 27th till December 31st. So we haven't gotten black and white, but in the initial guidance, it will be retroed to when the person was furloughed. And the amount will be given to us by Department of Labor, U.S. Department of Labor. It is not something that is negotiated or something that we ask for. So those guidances are working, and there are coming up with additional guidances as we speak, and they will be basically informing us as soon as these things are produced. This is a brand new program, and they're writing all these things as we speak, and it's going to be 100% federally funded and covering the administrative costs too. So we're working presently at coming up with an estimate based on the unemployment numbers that we have from the rapid response emails, which presently is at about 2,400 displaced workers and about 1,300 reduced hours. This is not even including the hotel industry. We're working presently on the executive order that the governor signed this weekend, and we are trying to automate a system for the employers to put in their reductions or their layoffs so that we can get an accurate tracking and unemployment and actually track it from here on out so we can see when the growth levels off and when we reach recovery eventually down the road. And this will help us ask for additional funding. So it's very important for all employers to report these numbers to us when we get the system up. So this will assist us in asking for relief monies.
Thank you.
Follow-up question?
Yes, I wanted to ask the governor about schools. There is some suggestion, I understand, or some talk that the school year may be dismissed or in some way abbreviated.
You know, I have not heard any of that, but the Lieutenant Governor's been in close communication with the superintendent. I do know that they would have to continue following our directives in terms of the closures. So I think Lieutenant Governor might have some more information.
Thanks, Kevin. You know, it is very fluid situation. So, you know, the superintendent and his teams are setting up programs for distance learning, and they are still working on those. So what we'll do is we'll get an update from the superintendent and we'll see whether or not he can participate in an upcoming press conference.
Thank you.
Host Guam, you're next. Nick Delgado.
Hi, Governor. Good afternoon.
Hi, Nick.
So I wanted to get an update to those being quarantined in the hotels. My understanding, or my question is, have any of them tested positive and have any of them refused to remain in quarantine, as there's this petition of order potentially extending the time that they would be in quarantine till the end of April?
No one, to my knowledge, has tested positive from the quarantine. The first wave of passengers that were quarantined should be up this Wednesday. So I'm not familiar with what you're saying about an extended quarantine for those people up to the 30th.
I believe that this is the one that Linda had mentioned last week, Governor, about her going before the court to get a court order to have those in the quarantine from the March 19th.
Okay, so I think she'll give you more clarification, but it might be like the time that you need to go before the courts to invoke the quarantine mandate.
Yes, that is correct. We're preparing as we speak, and it's an ex parte that we have to have the court petition for authorizing us to continue the detention, whether it's for isolation or quarantine. It's because we have the 10 days that has to be filed with the court, and in doing so, we want to make certain that all the respondents are able to have their due process. And again, we will be, I will be summoned to court, and so that will be happening sometime this week.
In regards to the FEMA disaster, any relief coming out of FEMA, can you explain what this means? Does it mean that we may be getting more SNAP benefits or household assistance similar to what we see post-typhoon?
Okay, so are you referring to the fact that we were declared as a disaster situation? Is that what you're referring to, Nick?
Yes, Governor.
Okay, so the president did declare a major disaster for us. And what that means is we can get more federal funds now through FEMA, of course. But in terms of individual assistance, that's under review still. We are able to get the public assistance part, which means supplies and so forth. So the individual assistance part is still under review. And Lieutenant Governor has more details because he attended the operational meeting this morning.
Nick, the disaster declaration is for emergency preparedness measures. So the issues that we're dealing with, the operations that we're dealing with regards to quarantine, identifying positives, facilitating all of the measures at the hospital and frontline healthcare, those are all what is currently approved for in the in the declaration we approved by the president. Category A, which is for individual assistance, is pending, and that has not been approved yet. And if and when that does, you'll know from the governor first. Thanks.
Thank you.
Nick. PDN next, Steve Untiaco.
Yes, hi, good afternoon, Governor.
Hi, Steve.
Hi. So last week you mentioned that there's a surge in positive COVID-19 cases is expected. Could you explain why that is expected to happen?
Okay, so according to the modeling, and this is a prediction modeling, it's trajectory modeling. According to that epidemiological calculations, they look at what's called the R0, and that, in my understanding, explains or shows to you the number of potential people that could get transmission from the contact of the virus. So like they're saying R0 for Guam is 2.6, which means that if I go out there and not do any social distancing and just, go and and do a lot of gatherings and so forth. I have, because it's a 2.6, that means that I can infect 2.6 people. And then those 2.6 people, each of those people will infect 2.6. Then each of those people of the 2.6 will also infect 2.6. So when you map this all out, it becomes exponentially high. And you've seen this, I think, in the videos where they had like one person, and then under that one person was two people, then two people was four people, over, and so on down the line. So they're saying if we don't do anything, this is what they're thinking might be the number of infected people. If you do something like social distancing, having people stay at home, decrease your activities out there, remove yourself from social gatherings, do telework at home. These are opportunities that would lessen then those opportunities or instances of infection. So according to that modeling, what they are saying we may be seeing is a surge. And so they do this calculation about our first day is, I think, I want to say like 20 days ago or something like that. And on those days, it shows a very, very, very low incidence of infections. And then by next week or the week after, we'll see a surge. So that's why we're really tracking every day what these actual numbers are of infection. And so far, we're not really that in sync with what their projection is. But we're still taking a very, very, very conservative, very cautious attitude in making sure that we don't get into that surge by doing the things that we just did, we just said. And that's additionally why we're very, very also concerned about incoming passengers. The United States now is the #1 in this coronavirus. They have over 130-some thousand people infected. And they're saying in some of the states that they're not seeing that surge either. So this is all, you look at this data, you look at this information, and you try to plan accordingly so that when it does happen, we are prepared.
Okay, Governor, another question. What's your response to the community groups who have asked you to demand more assistance and cooperation from the military?
I haven't seen that demand, so I don't know exactly what it is that they are asking for. I apologize, but I have been in close communication with Admiral Manoni every morning. I have spoken to Admiral Davidson, who's the head of the Indo-PACON from Hawaii. They have assured me and assured the community that they follow very strict infection control guidelines. They're going to be testing all of their sailors. They are going to be they've issued a policy of no contact, which means not even their own military personnel will have contact with the sailors. And they've assured me that none of our civilians that work there will have any contact with the sailors. And even those military people that work there and then live outside the fence will have no contact, because they have to also protect their own military residents, their own military forces. And so they're doing everything that they can to get the situation stabilized and so forth. So I am in close communication. I think I have full cooperation of the military in protecting our island and in protecting their people and our people also.
Thank you, Steve. Nestor from KUAM.
Hi, good afternoon, Governor. As you know, the legislature will meet tomorrow. This will be the first time they're gathering in session since this whole crisis started. And as we understand, there's going to be a whole slew of bills that will be geared towards addressing the coronavirus crisis, everything from raising the ceiling on the Dave Saunders Act, waiving, I guess, the set aside for the rainy day fund, rolling back the BPT, rolling back the liquid fuel tax possibly, and possibly even overriding your veto of the $1 million transfer authority. Can you comment on session tomorrow?
Yes, I don't exactly know what their agenda is tomorrow, but you know, of course, the senators are elected officials and they have constituents that they have to respond to, and they're just as concerned as you and I and everyone else about the status of this coronavirus. They're wanting to make sure that the public is given enough financial help. They're wanting to make sure that I am also provided with the policies and the resources that I would need in order for us to battle this viral nightmare. And so, you know, that's within their purview. They can hold their session anytime they want to. That's their authority. And if those policies that they are going to be looking at and passing is going to benefit more in terms of helping our people, I would look at that very closely. But I just want to also inform you that most of the ones that they're looking at is to provide direct cash to our people. And we are already doing that from an executive level through the federal government and the White House and the other and Congress. So they are pouring in, you know, a lot of financial help for not just individuals, but for businesses, for the hospital. They're pouring in a lot of that for us and also the 50 states of the United States, because everyone is suffering from this virus. They're suffering economically, they're suffering financially, they're suffering with their lives, most importantly. They're suffering from anxiety, they're suffering from, you know, being, staying at home. Our whole life is being changed by this virus. So whatever the senators can do to help, that would be much, I think, appreciated from us. But I need to also weigh out, what does that mean in terms of our recovery? What does that mean in terms of future sources and revenues so we can continue providing public safety, health, and education?
All right, thank you, Governor. And the second question is, as you mentioned, you're almost in daily contact with the Admiral about, you know, whatever the Navy, the military is doing at this particular point, but we haven't gotten any updates from them or any information on the Roosevelt and how many, where they're at in terms of dealing with the virus infections on board, how many more, if there are any. Can you share any of that information with us?
I would rather that you speak directly with them, because they do also have their own protocols of official announcements, Nestor. And, you know, I don't want to in any way impede in any of that. So, but I do want you to know that when we meet and when we talk, we actually talk daily on the phone. It's to continuously, again, give assurances that what they're doing is containing the virus, what they're doing is protecting our island from any other contamination. They are actually using their own internal infection controls, which is the same, not similar, but the same as our CDC guidelines and what we're doing. So we are comparing notes in the actions that we are taking. And I have to say that it's very much in concert.
Are they required to report to you how many infected cases they have? Because it's not being.
No, they are tracking that data and information through their own public health military system. Through CDC.
All right, thank you, Governor.
Okay.
Johanna from the Pacific Island Times. Let me unmute you. Johanna?
Hello, can you hear me now? Sorry. Okay. So what is the preliminary number of coronavirus-related unemployment on Guam?
Preliminary coronavirus? What is it?
Yeah.
Without the hotel and restaurant.
Oh, 2,400 without the hotel and restaurant numbers.
So, okay, so just 2,400 for now. Okay, and my next question is related to the relief that was just passed. So what exactly does this program do, the relief for workers affected by coronavirus? Like, is this just free money, or is it also maybe job training, maybe paid job training for certain workers?
You know, I don't think any money is free, but it is federal monies. It's not local monies. You know, the federal monies are coming from the tax dollars of all the United States. So it is federal money that is coming. It's not our local monies are not being used. We don't have to do any matching in any of those, I believe. But I'll have Ricky, who's been tracking all of this, maybe give you some more information.
Okay, okay.
Thank you, Governor. Hi, Joanne. So related to your question, there are recovery rebates that's been announced already, and I know that a lot of people have been reading it online. And those recovery rebates are underway. What we're doing currently is we're working with the Department of Revenue and Taxation, and they're working with their federal counterparts as it relates to these recovery rebates. And we are currently estimating the amount that the government is to receive so that we can get those checks out as soon as possible. As it relates to the unemployment benefits, and I know that Dave had mentioned earlier that we're also working on that estimate as well. And in terms of what we want, and how those are going to be paid out, we are waiting for guidance from the Department of Labor. And once that guidance comes our way, obviously we will go ahead and ensure that we do everything we can locally to get those checks out as well. So we're not waiting for the federal government, although we're actually going. I know Dave mentioned earlier we're asking them to give us some guidance. We're not waiting for it. We are asking them on a daily basis, as well as the Internal Revenue Service. And I know that there are a lot of questions that the business community has and are going to continue to have. And all of those questions we hope that we could answer as well, because a lot of times those questions are the same questions that the local government has as well. And we're working as fast as our federal partners are working in order to get those questions answered. And so if there's any other additional questions, obviously we can provide that information and those answers to you at a later time. But we're doing everything we can in terms of trying to get these relief, this economic relief out to our businesses and our unemployed and all of our individuals on Guam.
Thanks, Ricky.
Thank you.
Thank you, Joanna. Now closing remarks from the governor and our lieutenant governor.
Thank you again for this opportunity. I think these regular press conferences is very beneficial for our community, and also for us to make sure that you are informed and that we are as transparent as possibly we can be with information that we do have, accurate, up-to-date information. So I just thank you again for your understanding, your support, and your patience. And as we move forward to this battle of this war against this coronavirus, I thank you again for please staying home and making sure that you have as minimal contact as you can out there. Make sure that you're out there to go to the market, to go to the pharmacy, to go to the clinics, and then go right home. Thank you.
Thank you, Lieutenant Governor. Thank you, Governor. See you all tomorrow at 1 p.m.